Bone cancer is a tumor that starts growing in the bone. What does that really mean? Well, our bodies are constantly creating new cells and getting rid of old ones. But sometimes this process can go wrong. In bone cancer, cells in the bone start to grow and divide uncontrollably, forming a mass of abnormal tissue. That's the tumor. Bone cancer can be divided into primary and secondary types. Primary bone cancer starts in the bones themselves, whereas secondary or metastatic bone cancer begins elsewhere in the body and spreads to the bones. Primary bone cancers are less common and include types such as osteosarcoma, chondrosarcoma, and Ewing sarcoma. Osteosarcoma is the most common type of bone cancer. It typically develops in the osteoblasts, which are the cells responsible for making new bone. This cancer usually occurs in the long bones of the arms and legs, particularly around the knee and upper arm. It's most often seen in teenagers and young adults, especially during growth spurts, which suggests that rapid bone growth might make bones more vulnerable to this type of cancer. Chondrosarcoma is the second most common type of bone cancer. Unlike osteosarcoma, it starts in cartilage cells. It can develop anywhere there's cartilage, but it's most often found in the pelvis, upper leg, and shoulder. Chondrosarcoma is more common in adults over 40 and becomes more likely as we age. Ewing sarcoma is the third most common type of bone cancer, and it's a bit different from the others. It usually starts in the cells in the bone or soft tissue that are called primitive neuroectodermal cells. This type of cancer is most often seen in children and teenagers, with most cases diagnosed between the ages of 10 and 20. Ewing sarcoma can develop in any bone, but it's most common in the pelvis, chest wall, such as the ribs or shoulder blades, and the long bones of the legs. What's interesting here is that bone cancer is actually pretty uncommon. It accounts for less than 1% of all cancers. In the United States, for example, there are about 3,600 new cases of bone cancer diagnosed each year. That might sound like a lot, but remember, there are millions of new cancer cases overall each year. Causes of bone cancer. Like many cancers, bone cancer is likely the result of changes in the DNA of cells. These changes, or mutations, can cause the cells to grow and divide out of control. Some of these DNA changes might be inherited from parents. For example, a condition called Li-Fraumeni syndrome, which is caused by an inherited gene mutation, increases the risk of bone cancer and several other types of cancer. Most DNA changes related to bone cancer happen during a person's lifetime, rather than being inherited. Sometimes these changes occur for no obvious reason, but there are some factors that might increase the risk. Previous radiation therapy or chemotherapy for other conditions can sometimes lead to bone cancer years later. Certain non-cancerous bone conditions, like Paget's disease, may also increase the risk. It's worth noting that things like injuries or physical activity don't cause bone cancer. There's a persistent myth that a knock or bump can cause cancer, but that's not true. However, sometimes an injury might draw attention to a bone cancer that was already there but hadn't been noticed. Symptoms of bone cancer. The most common symptom is pain. It often starts as a mild ache that comes and goes, maybe worse at night or with activity. Over time, the pain typically becomes more severe and constant. But here's the tricky part. These symptoms can be similar to many other conditions, like arthritis or sports injuries. Besides pain, people with bone cancer might notice swelling or a lump in the affected area, which can sometimes be felt through the skin, particularly if the tumor is in a superficial bone like the rib or pelvis. Sometimes the tumor can weaken the bone, leading to fractures from minor injuries or even just normal movements. In some cases, people might experience fatigue, fever, or unexplained weight loss. But remember, these symptoms can be caused by many other conditions too, so having them doesn't necessarily mean you have bone cancer. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of bone cancer. To diagnose bone cancer, your doctor will ask about your symptoms, when they started, how they've changed over time, and if anything makes them better or worse. After that, imaging tests are usually the next step. X-rays can show abnormalities in the bone structure that might indicate cancer. But X-rays don't always catch early stage bone tumors, so doctors often use more advanced imaging techniques too. CT scans provide more detailed images of the bone and can help determine the size and location of a tumor. Magnetic resonance imaging is particularly good at showing the extent of a tumor and whether it has spread to nearby tissues. PET, or positron emission tomography, scans can be useful in determining if the cancer has spread to other parts of the body. If these tests suggest bone cancer, the next step is usually a biopsy. This involves taking a small sample of the tumor to examine under a microscope. There are two main types of biopsies: needle biopsy, where a thin needle is used to extract a small amount of tissue, and surgical biopsy, where an incision is made to remove a larger piece of the tumor. The biopsy is crucial because it allows doctors to definitively diagnose cancer and determine what type it is. There are 4 stages of bone cancer. Stage 1. This is early stage cancer. Here the tumor is low grade, which means the cancer cells look more like normal cells and tend to grow and spread slowly, and is still contained within the bone. Stage 2. The tumor is still contained within the bone, but it's either larger than in stage 1 or is high grade, meaning the cancer cells look very abnormal and tend to grow and spread faster. Stage 3. The cancer has spread beyond the bone to nearby tissues, or there are multiple tumors in the same bone. Stage 4. This is the most advanced stage. The cancer has spread to distant parts of the body, like the lungs or other bones. Treatment for bone cancer. The treatment approach depends on several factors, including the type and stage of the cancer, its location, and the patient's overall health and preferences. But in general, treatment usually involves a combination of surgery, radiation therapy, and chemotherapy. Surgery is often the primary treatment for bone cancer. The goal is to remove the entire tumor, while preserving as much normal tissue and function as possible. In the past, this often meant removing the affected limb. But thanks to advances in surgical techniques and other treatments, limb-sparing surgery is now possible in many cases. This involves removing the tumor and some surrounding tissue, then replacing the removed bone with a graft, which could be bone from another part of the body or an artificial implant. However, there are still situations where removing the limb might be necessary, particularly if the tumor is very large or in a difficult location. It's a tough decision, but sometimes it's the best way to remove all of the cancer and give the patient the best chance of survival. Radiation therapy uses high-energy beams to kill cancer cells. It might be used before surgery to shrink the tumor, making it easier to remove. Or it might be used after surgery to kill any remaining cancer cells. In some cases, when surgery isn't possible, radiation might be the primary treatment. Chemotherapy involves using drugs to kill cancer cells throughout the body. It's often used in combination with surgery, either before to shrink the tumor or after to kill any remaining cancer cells. Some types of bone cancer, like Ewing sarcoma, respond particularly well to chemotherapy. After treatment, follow-up care is essential. This usually involves regular checkups and imaging tests to make sure the cancer hasn't come back. Some people might need ongoing physical therapy or occupational therapy to regain function and adapt to any physical changes from treatment. Now we want to hear from you. Do you or someone you know have bone cancer? What symptoms did they have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.